It's a very great pleasure for me to be here today. I'm only sorry that I couldn't come for the opening on Tuesday, but yesterday we had the Health Select Committee where we were discussing the budget estimates. I know that sounds rather dull, but it's actually rather important in terms of the resources which are going to be available to the health sector in the next 12 months and beyond. But during the proceedings yesterday, the chair of the committee gave me a splendid opportunity to really offer a ringing endorsement of what you're trying to do here. And I'd like to echo that again today. I think the imagination that has gone into the creation of this centre and the possibilities that it represents are immense, and they're going to be of value not only to people in Auckland, but I believe throughout the whole of the health sector in New Zealand. So I wish the centre well, and I think over the years, as Mason has just said, we're going to see some really good stuff emerge from the work that people here do and the work they do with other people. Now, you'll probably be glad to know that I'm not going to actually talk about the estimates. I'm not actually going to talk about any of that sort of stuff. I thought what I would do today is offer something of a personal reflection on the whole complex subject of leading change and improvement in healthcare. And you'll be able to guess that I've been around healthcare systems for quite a long time. So, in a sense, I'm trying to offer you something of a synthesis of some of the things which I think I've learned after, let's just say, more than 30 years, trying to make changes and improvements for the benefit of patients. So what I want to do today is talk about the complexity of leading change. I want to talk a bit about what I think the key ingredients of success in that venture are, and I want to say something particularly about leadership. So that's my agenda today. And I believe if I press this button, it will move things on. Good. So let me start with a statement of the blindingly obvious. But it's worth reminding us ourselves that leading change in health is complex. Now, I'm not really best placed to say whether it's more complex than in other settings or places, but all I know is that it is very complex. What do I mean by this? Well, here's a few reasons why it's complex. The first is people. But let me be clear. I think one of the great things that makes working in health so enjoyable is because it is about people. People at vulnerable times in their lives, but also the vast numbers of very talented people who work in our healthcare system. It really is a pleasure to work with so many talented people from different backgrounds and all the rest of it. And the contribution which you all make to people's lives day in, day out is one of the great things about what we do. But of course, people are infinitely varied. They are inherently dealing with multiple things in their lives, and therefore change can be really quite a challenge. So that's the point that I'm really trying to get across here. So that what we're trying to do is make things different from the way they used to be. And that can be unsettling for people. Secondly, healthcare is really very interesting because of the number and strength of professional groups. I don't know if anybody's added up how many professional groups there are in healthcare these days, but it's a vast number. People who belong to professions not only have an allegiance to their patients, an allegiance to perhaps the institutions in which they work, but they also have a very important allegiance to the profession to which they belong, the body of knowledge that is embedded in that profession. And one of the things which I've learned over the years is the importance of being able to blend and work with multiple professions. So professions, great strength, but added complexity. Thirdly, science and technology. Healthcare simply doesn't stand still. There's hardly a day goes by when somebody releases a research paper or makes a claim based upon some kind of advance in our scientific understanding, or somebody develops a new technology. All of that, again, adds to the complexity that we have to deal with as we embark on change and improvement. Fourthly, uncertainty and ambiguity. One of the things which is really quite distinct about healthcare is that it's not always obvious what the right thing to do is. A lot is made these days of evidence-based healthcare. Sometimes people also talk about evidence-based policy. But often, when you're actually trying to tackle change and improvement, you could be at a point where the evidence starts to become thin, or is indeed uncertain or ambiguous, pointing possibly in slightly different directions. So how do we deal with that? Well, I actually think that there's nothing so practical as a good theory that you might employ in a situation like that. But dealing with that uncertainty and ambiguity seems to me to be another dimension of the complexity. And finally, scrutiny. One of the things which healthcare leaders have to come to terms with is the fact that there's an awful lot of people watching what's going on. And that's healthy. The process that I was involved in yesterday with the Minister, with the budget estimates in Parliament, is a really important part of scrutiny. But so is the work of the media, and so is the work of staff who are watching what's going on in organisations all the time. That scrutiny is very, very important. But again, it brings a dimension of complexity. So I just wanted to share with you those thoughts about the challenge which you are all taking on, because I start this conversation with you on the basis that you are the leaders. And one of my main messages today is that we all have a leadership role. It is not something that is the preserve of Geraint or other senior figures in this room. We all have a leadership role to play. And I'm going to come back to that theme at the end of my talk. So let me move on. I think, as I've kind of indicated, there are probably three things from my experience that are especially important in making change and improvement happen. The first is around organisations and systems, and I'll explain what I mean by that in a moment. Secondly, around engagement of both patients and staff and the wider public in the process of change. And again, I'm going to develop that theme for you. And then thirdly, some thoughts, personal thoughts on leadership. Organisations and systems. I'm going to put a quote up in a moment from somebody who will be well known to the people attending this event, Don Berwick. And it's a favourite quote of mine because what this quote, and I'm deliberately not putting it up just yet because I want to get this point across to you. What this quote conveys is the sense that we need to work together. If we think of change and improvement being pursued by individuals, we miss the point. So let me share the quote with you. And I'm just going to work through this. This was a paper that Don Berwick published in the BMJ a while back, but I think it still has a great relevance. Because what he's saying is that to improve healthcare, we require not better professions, but better systems of work. A system, in this sense, is a set of elements interacting to achieve a shared aim. Here's the trick. To improve the performance of the system, you need to attend more to the interactions than to the elements. You'll see a resonance here, in part, with what Mason was talking about a moment ago about care integration, which is another theme which I could pursue, but I don't want to. But let's just carry on with this quote. So great healthcare professionals interacting well with all of the other elements in the healthcare system make great healthcare. Professional associations that wish to lead socially responsive improvements in technical care, service outcomes and costs have no real choice but to invest in improving interdependency among individuals, professions and organisations. I believe that that is really so important. And at the heart of this is the concept of system and teamwork. And I have learned over the years that you have to approach the process of change and improvement with those things very much in mind. The second big theme to change and improvement that I've learned over the years relates to engagement. And I'm talking here about engagement of patients, the people we serve, and staff in the process of change. And this is a quote from somebody called David Naylor. David Naylor at the time, I think, was the Dean of Medicine at the University of Toronto. This is a quote from a conference I attended, organised by the OECD in 2001. And what this conference was looking at was, how does change happen in healthcare systems? What drives it? Where does it come from? And it was a kind of debate about the role of government policy making as opposed to other factors and so on and so forth. And this was the conclusion of a major review that Naylor and his colleagues undertook of healthcare reform around the world. And this conclusion, I think, is absolutely spot on. That however countries have gone about different reform activities, a hard reality has emerged, and it's this: that healthcare improvement starts from the ground up. It requires tenacious work to understand what does and doesn't work in real life, and the engagement of countless providers, clinicians, if you like, patients, institutions, and communities. And so our job as leaders is to create the context in which that engagement, that participation, that process of evolution of ideas and their implementation can take place. I couldn't help reflect, Mason, when you were talking about that psychiatric hospital all those years ago, that that's what was going on. A process of engagement and participation and people thinking again about how to do things differently, and somebody saying it's okay to do that and enabling it. That, for me, was a demonstration of great leadership to make that happen. So I think that's the point I'm trying to get across about engagement. So my third theme is leadership. And what I want to say is that leadership is much more than a word. I came across this quote the other day from someone called John Adams, who was the 6th president of the USA. Anyone who knows their American history will know that John Adams was actually one of the great intellects behind the American Constitution, a very great thinker. And because of the time he lived in, was working and living with some very distinguished leaders, obviously George Washington amongst them. And I was really attracted to this quote, which we as leaders perhaps need to hold in our minds. That if your actions inspire others to dream more, learn more, and become more, you are a leader. And I think that that's a really nice quote about what leadership is about. But I put this slide together also say, leadership is not just a word, because I was thinking about a couple of talks was planning to give around leadership, and I thought, well, what am I going to say that's not been written in some of these books that you find in airports? I thought, what will I do? And it suddenly came to me, what have you thought about leadership as an acronym? What on the basis of my personal experience would I say the key ingredients are of leadership? So I decided to treat it as an acronym, and what I'm going to do is share some words which reflect what I think I've learned about some of the key ingredients of leadership over the years. Unfortunately, because it is an acronym, there are some other qualities of leadership that I might not put a lot of emphasis on today, but I think it does serve a useful purpose. The first is learn. The L is for learn. And I think we've heard a lot about that today. I was able to be here this morning to hear Anthony Hill talking about complaints. And I think Anthony's thesis was absolutely right. Challenging though complaints might be, they are a fantastic opportunity to learn. But beyond that, we as leaders need continually to learn, to reflect, to discover new ways of doing things. Secondly, E is for example. And I think this is fairly self-evident. The example which we as leaders set is very, very important. And I suspect that the people in this room who've been in healthcare for some time will know the people in their careers who've had a great influence upon them because of the examples which they have set. So we have to hold that very much in our minds as leaders. The A is for adaptable. The world in which we work is constantly changing. And if we only do what we've always done, we'll only get what we always got. So being adaptable to the changes in the world in which we live is a very, very important dimension of leadership. The D is for determination. None of this is easy. If it was easy, we'd have solved all these issues a long time ago. So the D is for determination, the ability for you as leaders to keep a focus over a long period of time. The E, unsurprisingly, given what I've already said, is about engage. And again, I found this little quote, and I thought this captured it. It's supposed to be an ancient Japanese proverb. I don't know whether it is, but none of us is as smart as all of us. And I think that captures it. So my plea is, as leaders, to engage along the lines I talked about earlier. The R is for resilient, linked to determination. As leaders, it doesn't go smoothly. There are setbacks, there are disruptions. The thing is not to be blown off course. I don't mean to remain dogmatically committed to a particular course of action, but what I do mean is that the slings and arrows of outrageous fortune, you have to be able to bear them and see it through. The S is for support. As leaders, we need to support the people around us. We need to be able to offer a guiding hand, a word of advice, somewhere for people to go who perhaps are faced with some uncertainty and ambiguity about what the right thing to do is. So support is the S. And the H is for help, because all leaders need help. Can't do it alone. Big mistake to think that, in my experience. But one of the most difficult things for leaders to do is sometimes to look around and acknowledge that they need help from others. So leaders need help. The I is for innovative. We have, as leaders, to be able to think about doing things differently. We need to spot opportunities. We need to support others who've got ideas, let them test them, let them learn from them. Last night, I was fortunate enough to attend an awards ceremony in Wellington, where, surprisingly, I'm very pleased about this, the Ministry of Health won an award. And it won an award for the work which has been done over many years in relation to depression and suicide prevention. And you will have seen these campaigns, some of these campaigns. But the thing about this is that it started several years ago, and it has grown and developed, and it's now introducing a whole variety of new tools and services. And I thought it was an extremely good example of innovation. And so we're seeing approaches to care delivery for depression through what we might simply call e-health approaches. And finally, the P is for partners. And I mean the people with whom we work, not only in our immediate teams, but within a hospital, between a hospital and other important local services. Partners, leaders need to work at building partnerships, because nobody, no organisation can be an island. And partnership, in a sense, in this context for me, is also leads into a discussion about team. And I just want to illustrate this point about team with a very personal experience that I had a couple of years ago. But it also, I believe, will bring home my point that leadership is a role for everyone. It is not the preserve of a few people somewhere near the top of an organisation. And the story I just want to tell you is based in Afghanistan. 2 years ago, I was invited by the military to visit Afghanistan, to visit the health services in Helmand province, because the health services which are provided there are actually largely dependent upon staff who work in the National Health Service in the United Kingdom. People go on secondments or they're reservists or whatever. So there's a very close relationship. And the NHS in different parts of the UK provides all the training and backup support to these troops in the field. But the point I want to illustrate from this slide is about leadership. Whilst I was there, I was being taken around by a general and an admiral, so very, very senior military figures. And one of the things that was arranged was for us to go and visit an Afghan hospital. There's another story about that which I can't tell today. But this involved us going in a military convoy out of the secure compound of the Kandahar airfield. You can see from these vehicles, is that a pointer? Which is the pointer? Oh, right, sorry. You can see from the weaponry on this stuff that it had a degree of risk. The point is that, remember, there's an admiral and a general. They don't get much more senior than that when it gets to the military. This guy here, who was a young non-commissioned officer, was in charge of this operation. And when we set off, or we were going to set off, he got everybody together, the admiral, the general, the other senior officials who were there, and he told everybody what to expect, where they were going, what they had to do if certain events happened. My role was dead simple, stay in the vehicle. But he took responsibility. He showed real leadership. It wasn't a case of being intimidated by the fact that he had all of these senior people. He was a real leader. And I'm glad to say we all went off on this visit and we all came back. And I think that the message that I took from that is that leadership, there's a role for everyone. It's all of our responsibilities. So please, if you don't remember anything else about this talk, just remember that you are a leader, you have leadership skills, and by applying some of the leadership skills that you have, you can make great changes and great improvements in the healthcare that you deliver. Thank you very much indeed.